I had double jaw surgery. Today is my 5th day. First of all, the issue with my jaw was this. For a long time, I wasn't aware. I wanted braces because my teeth were a bit crooked. I went to a hospital. I was told there was a problem with my jaw structure. My lower jaw was too far ahead. For this reason, I was told that only camouflage treatment with braces was necessary. Or, if you prefer, it was mentioned that you could have a double chin surgery. If I'm not mistaken, the year is... Then a long time passed. I did some research. I couldn't find many sources. At first, it felt a bit scary to me because there was so much info and so many doctors, I couldn't be sure. Eventually, I began to decide because a client of mine, Mr. Ali, had undergone surgery. It was month 2 for him. He said there was no swelling, no speaking issues, and he was eating well, slowly starting solid foods. This was actually enlightening information for me. After getting his phone number, I spoke with him for a while. Then I wanted to book an appointment with Mr. Ali. I got the appointment and went to see him. He also said that my lower jaw is protruding. Even when I closed my mouth, my upper teeth overlapped, yet there was a gap in the back. This created major problems for me with chewing and breathing. After meeting with Mr. Ali, I went to the orthodontist again, just like before with Ms. Gonka. I chose to continue with the same doctor. I visited him and my braces treatment began for 2 years. If orthodontic treatment is not necessary, your doctor can give you a date or time accordingly. However, since there was a flaw in my dental structure and to fully reveal my jaw structure, I needed orthodontic treatment. I had nearly 2 years of treatment. After 2 years, I observed that my jaw was more forward. As my teeth began to align properly, the misalignment became more apparent. After my braces were completed, I still see that the effects will continue for a while after the surgery. After my preparations, I met Mr. Ali and got an appointment. My surgery date was established and my surgery day was fixed. I waited for that day. I had surgery on October 8th. Today is my 5th day. Honestly, I was a bit hesitant and somewhat scared. Despite having seen real examples, I imagined my face would swell up a lot. I thought I wouldn't be able to talk. I worried I wouldn't be able to eat. But now I can express myself very well. On the morning of the surgery, I learned that jaw surgeries are done early. I was at the hospital by 7 in the morning. I arrived first and they took my blood sample. They opened my vein. They asked you certain main questions. They inquired if I had any allergies to medications or any other issues. They were quite attentive until Mr. Ali came. I waited for about 30 minutes. Then they took me to the operating room. Because I was a little afraid of needles, I honestly thought about how the anesthesia would affect me. I was put on the stretcher. I was told they gave me a sedative via my IV. I don't remember anything after that. I opened my eyes. To be precise, initially after the surgery, it lasted 4.5 hours. It can take 3 hours, but mine was 4.5. I heard them calling my name and trying to wake me, but I wasn't very aware. When you first wake up, at least for me, I felt incredibly cold. It was very chilly. There was even a hot pipe like this. They were trying to warm me up with air. I don't remember anything after that because you wake up under the influence of anesthesia. You remember things in bits and pieces. Then you begin to sleep again. After a few hours, I woke up and felt no pain. My head was fully covered in bandages. I grabbed my phone first and looked at myself. There wasn't much swelling due to the bandages, so there was no reason to be scared of myself or avoid looking in the mirror. I had no pain at all. Once I started to come to, I felt a little nauseous and had a headache. This is quite normal because ultimately it's a procedure done inside the mouth and you constantly swallow blood. Even if a tooth bleeds, swallowing the blood can make you feel nauseous. Imagine how much blood you swallowed during the operation. I believe I was a bit particular about eating. If you're going to have surgery, I suggest gargling without fear and attempting to eat as soon as you wake up. Not eating causes your blood pressure to drop continuously. Nausea and headaches can affect you greatly. Today is my 5th day. The toughest part is only the first 2 days. After that, you feel much more comfortable. Sleeping at night is fine. I was discharged the very next day at 9 in the morning. I can walk very comfortably by myself. Except for the first few days, I can now walk and eat independently. I was quite curious about the sensations during my surgery research. I wondered how my lips and jaw would feel. Your jaw gets broken after all. The loss of sensation doesn't happen right away. But even on my 5th day, I can feel my sensation slowly coming back. My upper lip has no issues. I have sores in my mouth from the surgery right now. I can clearly feel the pain in my upper lip. But I'm starting to feel sensations in my lower lip and jaw. And I was really frightened by that. I thought I would have sores in my mouth due to stitches, that I wouldn't be able to talk, or that eating would be very difficult. There was no problem whatsoever. On the 3rd day, I started brushing my teeth on the 2nd day's evening. I had no issues at all. I'm saying this for those thinking about double jaw surgery. If you think about it, I wouldn't want you to delay your decision. But there is one thing to consider. You need a good doctor. I can really recommend Mr. Ali. I was very satisfied. It didn't turn out to be as scary as I thought. I don't want you to delay. I recommend making an appointment and coming to get some advice.